Hello, this is Oh Hyun-gun from ATA Dental Clinic. We've talked in general about Dio Ortho Navi last time. This time, I want to talk about how it is applied in actual clinical situations. There are various reasons why we use partial braces. In general, of course, I prefer full braces. I do prefer that, but not everyone are in the circumstances that allow having full braces. For example, this patient you see on screen is a model, so she can't wear the braces for extended time, while the braces should be invisible. So choosing the type of braces could also depend on whether each type of braces can accommodate these conditions. But if we can provide partial braces for a quick and effective treatment, that would bring a great degree of satisfaction for patients. When this patient smiles, you can notice the snaggletooth here, which makes her smile look asymmetrical, which makes her entire face look asymmetrical as well. Through orthodontic treatment, although it's only a small change inside your mouth, you can see her whole face looks more balanced and symmetrical after. I believe other orthodontists who have done plenty of treatments in the past would agree with me on this. I also believe having a system that works in a short time, despite our professional limitations, is a big advantage. So, the first thing we need to consider when we start a partial brace treatment is to focus on the goal of the treatment. Patients generally think this partial brace will fix all their issues, and this can lead to a big problem. And partial braces are for only anterior teeth, so there are some inherent limitations. It's important for the counseling staff as well as the orthodontist to understand that. We need to understand the system and communicate it to the patients well to avoid any arguments after the treatment. And to you can continue to utilize the system to your advantage. Now, this looks like a snaggletooth on the side, but this can be treated to be in alignment, looking like this. Later, we could address things like the shapes, which can be done by laminated veneers to make them dramatically more aesthetic. But the patient's posterior occlusion remains as is. Because it is a partial treatment, and this patient probably needed a full brace, yet it was impossible, because of personal circumstances. And look at these lower anterior teeth, with a tooth missing here, a premolar. So all these teeth are leaning to the side. It isn't easy to align them without planting a tooth in this case. About these limitations, thinking that all teeth problems can be solved through a digital setup can be very dangerous. If there is a missing tooth, or in a special case like that, it is vitally important to understand the limitations and counsel the patient accordingly. For those who are new to our OrthoNavi system, I recommend you try the system step by step. Actually, even among Dio OrthoNavi users, many people use this buccal system. Rather than the lingual system, when you use the buccal one with 2 strands of wire, we can see satisfactory results, even for severe case of crowding. So if you are just starting, beginning with a buccal system is not a bad idea. Anyway, our OrthoNavi uses 2 thin wires for various improvements, angulation, torque, and vertical control as well. So I hope you try to use the buccal system effectively. This is an old version that it was difficult to hang an elastic band. So we placed a Kobayashi hook here. But now we have an improved design to use with elastic bands, so please keep that in mind. So, we finished the treatment when we achieved our preset goal, which took us about 6 months, 6 to 7 months, I think. In this case, if we did a full brace, it would have taken much longer. This patient was an artist for entertainment industry, and we needed to finish treatment quickly before some sort of program she had to attend. I asked if it would be okay to place a brace outside because a full brace will take a longer time. And she okayed it, but wanted to be as fast as possible. So we decided to focus on anterior rather than posterior, and this is the result. Now, there are some vertical issues in crossbite. We can fix these issues using a buckle system through double strands of wire. There also was a deep bite, which was not the best situation, and the result is obviously not perfect. But given that it was a partial brace, I think it turned out quite well. You can see there are bite resins. We had to place them to correct the cross bite. Even when I do the outside braces, I also often use the inside system simultaneously. I personally really favor treating from the both sides, because they work in different ways. Only because you are treating it in one way, it doesn't mean you always have to stick to your method. If you need some treatment inside, go for it. Or, if you are treating from inside, but you feel the need to place something outside, then go ahead and treat from both sides. So, if you are starting, I recommend you to use the buckle braces to familiarize yourself with the system. And when you realize how well the double wire system works for your advantage, then I'm sure you will gradually expand your horizon. Now, if you are comfortable with the buckle system, then you can try the combination such as buckle for the top and lingual for the bottom. It's a variation, so-called combi brace. It typically refers to the lingual for the top and the buckle for the bottom. But I did the opposite for this patient. The reason for that was the patient didn't mind having braces outside at all, and it's my personal preference to do lingual for mandible. So I chose to treat the mandible from the inside. The benefit of doing this, the lingual brackets are not on the maxillary, so there's no need to raise the bite. So, if you feel uncomfortable and burdensome with raising the bite, then you can use the variation of the outside for upper and the inside for lower teeth, because each work well for what it's supposed to do, and you'll have a good result. Because we use double strands of wire, we can control torque or other things, such as vertical control well. Correcting from the outside for the top and from the inside for the bottom. Well, in this case, you can do both from outside. But personally, I prefer the lingual side for the mandible, because, as I've said before, it is faster and better to use power chains with less side effects, especially in case of buck teeth like this. If you give a couple force from lingual, they can be treated really quickly. It only takes a month or two. These are the reasons why I prefer the lingual side. So treating the top from the outside and the bottom from the inside could be one way to do it. You may not think about these things, but if you realize there are different ways to utilize the system, it'll be more beneficial for you. Then there is the lingual for the top and the buckle for the bottom. This is the typical combi brace, and it is popular among patients. Because when we smile, the upper teeth generally show more. And so we treat from the inside for the upper teeth and from the outside for the lower. In this patient's case, I've bonded brackets up to number 6 tooth, and this is a few years old case. So you can see there are broken brackets. However, breakage has been significantly reduced now. Even when I do the lingual side for the upper and the buckle for the lower, I often use additional device on the lingual like you see here. There was a big torque to the front here, but it was fixed and we could finish the treatment. Of course, it could have been better with a full brace. Full braces are always better. But this patient as well, because of cost and time, couldn't do it. The fact of center line not matching, molar occlusion not matching, and such were understood and agreed upon by the patient in advance. That's why I even started the treatment. You must not start treatment without going over these things with the patient in advance. Never guarantee everything can be done, okay? Also, what I really want to point out is this. Many dentists who want to try OrthoNavi system choose a really complex case as their first trial. The reason might be because when they see interested patients in getting braces, most of them have pretty serious issues with their teeth. And so they start the system with the patients like that, realizing it's not easy to do. As I mentioned before, OrthoNavi system is not merely placing brackets and wires in them. In order to have good results, we need to use various techniques according to the needs. And if you start with a difficult problem, before you can take a step forward, it's over. Thinking you can't do this, that would be a real shame. So I recommend you start with a rather easy case at first. Let's say the female patients who visit your practice in their 40s to 50s. Almost always their anterior teeth is crooked in the maxilla or mandible in one way or another. The reason these patients don't want to have braces is because they are placed on the outside. But if you tell them there's a way to do it on the lingual side, it'll be quick, within 6 months. They will be more willing than you may think. They don't do it because they don't know there's this option. Once they know, they would want to do it, I'm confident. So not only the patients who came for the braces, but also the other patients you see every day are also the potential candidates for the braces. But if you are not prepared with a system for those patients, you'll be missing out. For example, you may say, I only do clear braces, but clear braces isn't appropriate for all cases. Clear braces really depend on whether patients follow and cooperate with your guidance at home, which is not easy. Also, there's a limitation for them as well. Because of these things, many dentists give up trying. But there are various partial brace systems you can use, and each has its own advantage. Utilizing all of these things will help you managing and growing your clinic better in the future, I believe. So, I suggest you start with the outside braces, then the outside for upper and the inside for lower, then the inside for upper and the outside for lower. Having various combinations of treatment will become an advantage for you and your practice. Now, once you get used to a certain system, then you can go a step forward. Then you can go another step forward. When you do build enough experience with lingual treatments, treating the teeth turned measly inward like this one is so easy to correct. Simply giving a couple force will expand them out like this. It looks difficult to do, but you can totally do it. The only thing is, because of its thickness, you can't bond it in the beginning. In such a case, we can use these buttons. I made these shown on photo, but Dio now provides pre-made stock buttons. So you can use them and place an elastic band at the beginning. Then the teeth expand easily. And there is a hole in the button, so you can use a wire if you like. You can use these items to expand the teeth efficiently. Also, when you watch a presentation like this, pay attention to what kind of method the speaker used for different cases. That way, those of you who are not used to doing braces can learn what can be done in what situation. So when you see your patients who come for cavities or implants, you can also recommend them for braces if you see the need. But if you tell them they need to have all outside braces or full braces, and it will take more than a year, the patients will not listen. But if you can explain these things well to them, like I've said earlier, we can do this from the inside, and the treatment takes only 6 months. Then the patients will be more interested. After you get used to various systems, then tackle harder cases one by one. I believe you will be successful. Then, when you feel really comfortable, you can handle complex cases. I have observed a lot of cases where, if one tooth is severely crooked like this, clinicians extract this front tooth, then place braces. Then, what happens is, the black triangle on the front teeth becomes really big. I've seen a lot of cases like that. I've been doing braces for a long time, but I've extracted the front tooth maybe twice. Extracting the front tooth needs to be avoided as much as possible. You need to be able to gouge how much expansion is possible to be done. People with severely crooked front teeth typically have small arches, so you need to expect the arches to become bigger. Then you need to have strategies on how you would align them. Because there's no room here, you can use open coils to expand. If not, you can use arch wire expansion. Dr. Bae Ki-sung will explain that in detail, so please watch that lecture. You can use whichever technique that suits you. For me, I typically use open coils. It depends on your taste. So when you have space here now, you can use elastic bands. Treating with power chains on the outside for expansion is too risky for side effects, so I normally go with the inside treatment. Once the tooth turns to some extent, you can start attaching brackets, starting with a really small size bracket, like you can see here. These are made of composite, so you can grind them to decrease the size as you want it. It still has no problem hang chains and wires here. So when the teeth are somewhat aligned, they spread out like this. Then you change the bracket size to normal. Then you place 2 strands of wire, although it's not perfect. It's enough to satisfy the patient. Even if when we treat it from the inside, you can add this outside if it's necessary. You can use various instruments like open coils, and it will help if you learn how and when to use these tools. But when you first try, for example, let's say you order a new case from Dio, and Dio sent you a digital setup for expansion. But if you haven't had experience in using one, it's not easy even to attach it all. So even when you have a digital setup, you need to constantly think about how you would reach the condition where you can attach the devices and place the double wire in the shortest time as possible. That's why I stress so much today that you need to create your own recipe from all these different techniques to run your own practice successfully. Do the expansion from the inside, but you can add something for alignment on the outside. And when it's somewhat done, add something for the alignment on the inside this time. This kind of customized approach is an important factor, I believe. We can't place the device here in this case. We can't place it here. But if you look at it, the dental arch line is formed like this all the way here. Then you know these teeth need extrusion. Also, in order to place brackets, these need to come out. Now let's think. If we push them backward, it's hard because of the anchors on the posterior. It's much easier to push them forward than backward because the front teeth are weaker. Then we have more space. Now we can bond the device like this. And then we can handle the proper gap between teeth, etc. I reiterate that you can significantly control the rotation, tipping, and torque using double wires in clinical cases. When we do braces, there may be vertical issues. The teeth could float like this. In such a case, you use a hook as I mentioned. Using hooks and elastic bands, you can lower them down. This is also something you should keep in mind when you treat the teeth from the inside. As I said before, most of patients don't mind using braces for this because it's not a long time, especially after the alignment is almost done. It's just temporary use for only 2 to 4 weeks. You need to practice simulating these processes in your head in advance. Then you order from Dio, and Dio prepares a setup. Then you can picture the whole process. And you should keep pondering about how you could do it faster, how you could place the brackets quickly, how you could start the double wire system quickly. We should constantly think about this. Only through that, you can plan in advance like this. I'm going to do this for the patient's next visit. I'll use this method for the patient's next month. What I mean is that this is not something you simply order and hang a wire on a bracket. And also, you need to use additional devices in places if necessary to have successful orthodontic treatments. Like elastic bands, although we treat from the inside. Typically, we like to put a power chain across 4 or even 6 teeth. But then by this force, this tooth's distal is pushed in, and this tooth as well. Of course, there would be a measly pushing force as well. Like I've said before, the lingual treatment has the benefit of applying force at the center of teeth. The side effects are minimal. 008 wire is, although very thin, when you expand teeth with it, you can see the distal came in. It's really important that to know how to use these different kinds of tools for specific cases. To do so, you need to have clear knowledge of which force on which tooth would result in what kind of movement. I'm sure we will have more opportunities to talk about these in more detail when we can meet in person. After COVID situation gets better, hopefully next year. Here as well, there is a lingual torque that the tooth is facing inward. The whole mandible is skewed inward as well. In these cases, as I've said earlier, we need to do proper vertical control, torque control, and rotation control for the whole mandible. You can see there are bite guides since we are treating it from the inside, and the middle teeth don't close during the treatment. That's why, again, it's important to get the wires in as soon as possible. Now, suppose you are looking at this picture and planning for the treatment. Picture the digital setup in your mind. The mandibular anteriors are low, right? You would want to raise them to this line. Then, this will be treated with some intrusion force. And for the mandible anteriors, because the gum line is high like this, you will plan a setup in your mind to bring it down. Then you just need to check if these forces work properly during the treatment. When the treatment is completed, the bite closes normally again, as you can see. As I mentioned before, you don't need to worry about the occlusion because of the raise. Like so, if you keep practicing with easy cases, you will feel more confident to try tougher cases. I'm not saying you should use a partial brace here. You should do a full brace. Full braces are always better. But if there's limitations, such as money or time, but the patient still wants to do something about their issues, then you could suggest doing a partial braces, always with patient's consent. You must not opt for a partial when you can do a full braces. This case was a little too much for a partial brace. There won't be many dentists who would choose to treat this with a partial brace. The reason I'm showing this to you is not because I recommend it, but to show the efforts that went in to treat this case in any way possible. In a case of mandibular anterior teeth gone inward like this, the lingual system is much better than the buccal system to pull them outward. It's because the force can be applied from the center of the tooth. And then there's asymmetry as well. The occlusal plane is a little off. To correct this, you would need additional devices and tools as well as certain level of experience for a clinician. But the more you do it, the more you would be able to tackle cases like this. What I'm telling you is not to take a case like this when you are a beginner. If you do, there is a big possibility you will give up in the middle. That's why I recommend for you to try mild to moderate cases in the beginning until you get used to it before trying tougher cases. If you look here, we extract this tooth because of apical lesion. This one is severely twisted, but it's doable with expansion to straighten it completely. There's no need for a special technique, but placing appropriate forces in right places will make it possible, and it's not perfect. For constructing the occlusion, partial braces does have their limitations, but it's important to come to a clinical acceptable level. This case was for an older patient, and it was a shame we had to finish here. If we could have treated the anterior teeth with torque in a full brace, making the teeth upright, then it would have made it much more aesthetically beautiful. But still, the patient was very satisfied with the result and her smile after her treatment. In this case, when you have reflux esophagitis, the anterior teeth's enamel gets corroded and weakened. As a result, their tips can break off while chewing. Now, the patient walked in this condition. I told her that she needed a full brace. She said she couldn't do full braces outside because she was preparing to become a flight attendant, and she couldn't do it. In situations like this, we need to have an alternative option. The teeth were all corroded, so I made temporary pieces out of resin and attached them to the teeth because I needed to see where I would have the teeth line. And because of the corrosion from the stomach acid, I couldn't place the devices on the lingual side. Because the enamel was completely eroded, dentin adhesion wasn't possible. So, I had no choice but to do a clear aligner for the upper teeth. For the lower, we did the lingual treatment to push the tooth inward to make prosthetics look nice. So we continued with prosthetics after our treatment. So at first, it looked empty around these teeth, making her face even look skewed, but the treatment was completed successfully. If we had a full brace, we could have fixed the teeth axis and such producing a better result, but the patient was satisfied enough. Even though only the front teeth were corrected, you can see the subtle asymmetry of the face was also fixed. Orthodontic treatments seems not to only fix teeth, but also improve other facial issues as well. This effect seems possible not only with full braces, but with partial braces too. However, please remember that you cannot say all issues will be resolved through partial braces to patients. If you look at it from the side, it was changed like this. Let's suppose that you don't do braces, and this patient came into your office. What would you do for her? Overjet is severe with crossbite here. If you would have attached partial teeth, you would need to do nerve treatments, then insert posts, and so on. Even then, you can't guarantee a successful result. But accompanying a brace in the treatment, we can get a better result. And more dentists do general dentistry and orthodontics than who only do orthodontic dentistry. So if you have this tool in your toolbox, you may derive more successful implant treatments as well. I believe it will be beneficial for you to utilize this system more actively. If you look at it from above, it is corroded. Actually, I wanted to treat it from the inside, but we had to use an invisible aligner for the upper teeth. That's why it's not perfect. Because we needed to finish the orthodontic treatment within 6 months, including expansion before the prosthetic treatment. So we did it this way, although it was not perfect. The benefit was that there was no need for the nerve treatment, and teeth grinding was reduced. Another benefit was that there was a better occlusion shape between the upper and the lower teeth. In fact, among the patients who come for braces, many come for twisted teeth or turned in or out teeth, but many others come to fix the gap in the center. So now, I want to talk about clear aligners. I've told you that overbite control is very important in lingual treatment. Otherwise, after you fix the gaps, if overbite wasn't corrected, they will spread out again as soon as you take the devices off. Also, when there's a deep overbite that these teeth almost touch the gum, then we can't place retainer inside because of that. Even if we can close the gap, dentists who are not familiar with the orthodontic treatments don't have these concepts. So please keep in mind that overbite control is very important in partial brace treatments, alright? If you don't comprehend fully, I have explained it in detail in previous videos, so please check them out. Likewise, this case can be done by lingual braces for the upper and lower, but if you are not comfortable with them, you can use a clear aligner for the upper teeth. And there's a gap in the posterior in this case. We need to get rid of this space as well, so I figured the clear aligner would work better because we cannot close the gap using a partial brace. So the clear aligner for the upper and the lingual braces for the lower. The reason for the lingual system is because although we can do it from the outside, the lingual system works better for the intrusion. So it is better to choose the lingual treatment for the lower teeth. When you look from above, you can see the gaps. You can crown or laminate them all, but the teeth shapes won't be pretty because they are going to be wide. We must close the gaps. To do so, the relationship between the upper teeth and the lower teeth should look like this, as you've seen earlier. Even after the mandible anterior teeth came closer, when anterior movement is applied again, the teeth will all go back to their original states. That's why we must do the vertical control first, before closing the gaps to keep it stable and maintained for a long time. Because we need to push down the mandibular incisors, we use the lingual system that is effective with the intrusion for the mandible, and the clear aligner for the maxilla. There are protruding bite lamps like this on the inside. Every time the patient closes the mouth, the protruding parts touch the mandibular incisors, keeping the posterior floated. And this applies force downward so the mandibular incisors will result in intrusion. In my own experience, if I would compare the ORT brackets that I made and used in the lingual side and the clear aligners with bumpers, bonding device is clearly superior. But if I use clear aligner, I can't lower them as much as I want. Truthfully, after a lot of clinical experiences, I believe in providing the movement that is clinically acceptable. So for those of you who don't feel comfortable with the lingual treatment, especially for the maxilla where you need to add bite resin and such, then you can use this combination treatment, which is a clear aligner for the maxilla and the lingual treatment for the mandible to achieve a successful result. As you can see here, canting is severe, and there's a space also. In cases like this, we need vertical control. So we've bonded for the mandible on the inside. Please forgive the photo quality here. And for the maxilla, we need to close a gap with a pushing force from the molars on the left side to the canine. And when we treat them using a clear aligner. When you first look at a case and notice there's a little bit of a gap, then the first choice is a clear aligner. When you don't have crowding butt gaps, a clear aligner is very effective. It's sort of a rule. It's not hard to close anterior gaps using a clear aligner. But if you look at this, the mandibular incisors are almost touching the gum. Then, as soon as you take the braces away after closing the gap is achieved, all the teeth will go back to the original state. And there's no room to place any retainer inside here. In these cases, you can use a diastema resin or something like that. But you already know they easily fall off from your experience. The reason is, after all, because there's no bite control. As you start thinking like, because we need to do a bite control, we can do intrusion on the mandible and close the gaps for the maxilla. Again and again in your head, picturing your treatment plan, you will be able to give better options for the patient. And the explanation regarding the treatment plan, duration, side effects, etc. There's extreme extrusions here. We need to push down the mandibular incisors, so we used a clear aligner on the maxilla. But it didn't improve 100%. Although it improved a lot by pressing them down, and the torque was also improved from sticking out a lot. But after all, you can say that the combination of a clear aligner and a lingual brace on the mandible is a little less effective compared to the lingual brace, both for maxilla and the mandible. The patient was over 60 years of age at the time, and he needed a full brace. It was definitely a case for a full brace. But the patient didn't want the full brace due to time, inconvenience, etc. If he says he would be satisfied with this much result, then you can start. And then we can show the patients the estimated result in advance through a digital setup. And you deliver not too different from that. It's totally doable with good communication with the patient. I've shown you cases for the combination treatment with a clear aligner for the upper and the lingual brace for the lower. But now, I will show you how I did vertical control using the ORT brackets I've made. This case also has mandibular incisors almost reaching the gum. If you connect the gum line, you can see it's raised like this. So it needs to come down. That's why vertical control is so important. So I bonded the braces on the inside with ORT brackets for vertical control. And with a brace, we close the gap in the center. The posterior teeth don't close. There's just a downward force consistently. In a clear aligner's case, it's detachable, so patients don't wear it for 24 hours a day. They don't always wear them. So then there's no consistent downward force. On the contrary. These brackets are attached permanently, so the force is applied 24 hours a day. And most of us clench our teeth while sleeping due to stress. Because of these factors, it can cause intrusion effectively. So please don't forget to remember to do a vertical control in cases where you need to close a gap with braces in the space case. And keep in mind that full lingual braces are more effective. But if it's too burdensome, then we can use the combination of clear aligner and bumper for the maxilla and the lingual bracket for the mandible. I believe it will still make a satisfactory result for the patient. If you get comfortable with everything I've said so far, then you can start utilize the system more aggressively. This patient has a retainer, as you can see here. He was an actor in supportive roles. He had 3 orthodontics treatments in the past. In fact, I even recommend a full brace. There was a shallow bite on the molars, and we needed to fix the asymmetry by expanding the dental arch, but he couldn't proceed for his personal reasons. In this situation, we need to somehow fix this situation quickly, so I've placed brackets here, and you can see a mini screw here. And this one is an implant, so it's the same with having 2 mini screws. So after I've done alignment, I've made more space here by grinding the tooth, then pulled it this way. Of course, I could have put the screw inside, but then it's too uncomfortable. So then we put it outside, then the hook goes outside too. And by pulling it this way, the whole mandible is pulled inward, matching the center line, improving the crossbite. In this case, the patient's face looked skewed. And even afterwards, it wasn't perfect because it wasn't a full brace treatment. But you can finish at the level of patient satisfactory. You can apply various ways in your practice. When you are comfortable with different techniques, for example, you can use hooks, buttons, or mini screws rather than brackets with wires. You can customize the treatments the way that would fit you. Now, this patient was a retreatment case. It was treated, but this part is tipped outside like this. and we want to pull it back in. This is a difficult case. It would be hard even with a full brace. We use double wires for expansion, and you can see screws here. I use these screws to pull them back. This tooth may turn by pulling, but it goes back once we take it off because we are not using the brackets for a long time. We could treat this patient with those screws and such. He was in class 3. And we were supposed to have prosthesis as well, but he changed his mind suddenly not to have it. If we had prosthetics, we could have matched the center line and have the treatment more complete. That remains a regret for me. Anyhow, there are multiple applications. I just want to make sure you understand that wire treatment is not all, but we can add and change to have various applications to treat more cases in shorter time, and we can achieve our goals successfully. So let's say you are comfortable with all these things. For me, I do a lot of lingual treatments or combi braces using typical brackets. But for those who are not very familiar with those techniques, can try to do the treatment by connecting premolars and molars, which is a high-level difficulty orthodontic treatment. Please forgive the photo quality here. But for cases with narrow dental arches and cases where we need to pull out a tooth that went in, the lingual treatment is a lot more effective. And when you are done, look at the torque. If you pull the tooth outward, it would have been hard to achieve this kind of torque. To do it, we need to use a very thick wire, either using a torque spring or a wire bending. But in this way, you can get this kind of angle with a thin double wire. It would have been impossible to draw this result working from the buccal side. It was only possible because it was from the lingual side. So if you see this kind of cases where the lower incisors are turned inside, then your first choice of treatment should be the lingual side. But if you are still a bit uncomfortable with it, then you can use a variation method where you can use premolars to treat. Like this, you can go further one step at a time. Then I believe you'll see good results. This patient is a so-called failed clear aligner case. She failed a clear aligner treatment from an invisible dental clinic. He insisted the devices be completely hidden, so I had to do an experimental treatment for him. In fact, to treat him without extracting this tooth was a stretch, and the posterior is also very much asymmetrical. So this was not a typical treatment at all. It would have been more appropriate to have a full lingual or full buccal braces, but he couldn't, due to his personal circumstances. So I am not fully satisfied with the result. But we could bring this skewed tooth to a normal position. But this was rather a stretch. I am not recommending this to you guys, but I wanted to show you that even a case like this could be handled by this system. I have shown you a lot of cases today. The start is to try to use the Dio OrthoNavi buccal system so that you can experience the effectiveness and convenience of the double wire system with slots and get your feet wet in the digital orthodontic world. Then try the combination, the upper from inside and the lower from outside. Then the clear aligner for the upper and the lingual for the lower, and then both lingual. What's important here is to choose the most appropriate and effective type of treatment for each patient's case and for the comfort of the patient. For example, the clear aligner for the upper and the lingual for the lower may be decided case by case, each time depending on the circumstance and the goal. Just thinking that it could be done, and Dio will do the setup, and I just place them to expand and alignment may occur a mistake. But again, I recommend you start with an easier case rather than a complicated case, to get familiarized with the system. Your hands need to get used to the materials and the steps. But in this way, you can develop the skill one step at a time. You must have competitors of other dental clinics in your area. But if you have another tool in your toolbox, it'll help in getting good reputation or bringing in business. In addition, it can help your service quality. For example, you can offer pre-prosthetic braces, or if a tooth is skewed, the gum health must be bad. And while you tell the patient about gum health, you can offer a solution treatment, which is quick, and the device can be hidden. I believe many patients don't do the treatments because they were not offered. If they were offered, I believe many would agree to the treatment if they know that there are these options for them. So I think the time to prove if it's a good system is over. The materials have been improved so much. At the beginning, we had a lot of trials and errors, but now it's past the argument if it works, or it's clinically applicable. Now is the time to figure out how we will make it more applicable, and this is not the end. We will have the version 3 next year. Like this, the system will continue to improve, and the wire and such will also continue to improve. So I hope you will continue to support us in this effort. Thank you so much for watching for a long time. If there's another opportunity, I hope to share more cases with you to demonstrate our system. Thank you.